just a real quick introduction. When I talk to folks, what I'm going to talk about here is kind of the context for the research. And then I'm going to give you a, kind of a synopsis of what I've been finding. And I think after everything that's been said tonight, it's going to make a whole lot of sense. All right, and I actually expect that a lot of folks in this audience are going to relate really well to this. Whether or not you've had direct experiences, you know somebody, you have some idea of what it is we're talking about here. So, and we're going to get this to work, right? Okay. Got it. All right, so the first thing I did actually when I was thinking, what I've been doing when I followed the healthcare reform debate is look at the opposing viewpoints. So again, hear a lot about this, talking about the different discourse. Governors say Medicaid not only is the nation's largest healthcare insurance program, but it is a vital healthcare safety net. That's all of our governors. Then you look at this, the Michigan League for Human Services right here in our own state has written this Debbie Stabenow out just this summer saying we need Congress to explicitly address inequities in healthcare, principally people of color and those with low incomes. Opposing viewpoints, you've got the Heritage Foundation, conservative think tank. If individuals covered by Medicaid suffer from health disparities disproportionately, Congress should consider excluding low-income individuals from the reform promised to all Americans. Excluding them. That's this summer. All right. Opposing viewpoints. Let's figure out what would happen. Over time, Medicaid's role in U.S. healthcare, I'm going to say this kind of in an oversimplified way. This is the context, particularly for my research. So we understand, it was said earlier that it was a series of kind of accidents that brought us to where we are. And this is absolutely true. However, some of the plan was what we call in policy coherent. Okay? And what we're trying to get to is another coherent plan. Coherence really just means that everything fits together. Okay? So if you qualify for Medicaid, and you know, if you're low income, you should qualify for Medicaid, for food stamps, for TANF, for SSI, for any of those things that you need, and they should fit together neatly in a puzzle, right? To do that, we used to have applications that would, you know, go for all one thing, and you know, you wouldn't have to stand in 6 or 7 different lines for hours and hours and hours in a month. Now we have to do that for various reasons. Now Medicaid is relatively isolated. Been decoupled from every other program, almost, and sometimes it's now competing with other essential services and benefits. And that's what my folks are telling me in these focus groups. In terms of the economic factors, we've always had a subsidy. It's paid by a federal match rate by 50 to 80%. And originally there was direct care through these community health centers. We have that a little bit now, not as much. By 1997, the system was privatized. By 2004, the majority, 60% of beneficiaries were in managed care, and this is in Medicaid. So even our public system is being privately managed to a degree. When that happened, rolls dropped by 4 million people. We lost them, just like that. Okay. So now, talking about the political factors, again, been mentioned before, states differ in eligibility requirements. So we have essentially, at minimum, 50 different Medicaid programs. There are still some fundamental requirements, and the list is quite long. But we do, you know, one person who lives in Michigan, if they had the resources to move to another state, they may or may not qualify, just by moving from state to state. I already mentioned the decoupling of Medicaid from TANF. We lost folks then, even as flexibility increased. More people were technically qualified, but they didn't get their welfare, and so that in the applications weren't together, so they didn't know they could apply for Medicaid, all these various issues. And with welfare reform, talk about the immigrants, even legal immigrants were no longer eligible for the first 5 years. So we've talked about the expansion of retrenchment. It really doesn't matter who's in the administration at any given time. Okay, we're going to move on, right? So benefits, we've talked about this, older adults, including 70% of folks in nursing homes get Medicaid. It's the primary source of long-term care in the United States. And you have categorically blind, disabled, and families with dependent children. All right, so we have a lot of different categories, but in a lot of ways it's very limited and excludes a bunch of folks. There's increasing enrollment in Medicaid, okay, but only 40% of people living in poverty are served. Only 40% as of 2006. And private insurers are increasingly making those health care decisions for those people. Okay? So, and in my population that I'm looking at is this last category, mostly people who are participating in multiple programs. You've got dual eligibility with Medicare, Social Security, SSI recipients are automatically enrolled in most cases, but it's actually pretty hard to get an SSI anymore too. And TANF recipients, as I said, are no longer automatically eligible. So this is a problem with this idea of coherence. Okay. These are the folks that I talked to. All right, I just have 2 quotes from the many, many focus groups, but they really kind of represent kind of what's going on here. 2 of the main issues that what I talked about is this thing called income packaging. So you add up all your bills and you figure out where your money's coming from, and then you figure out kind of what package, how you're going to package all these different income sources to pay all your bills. And if you've got 8 or 9 different income sources, all giving you little dribs and drabs here and there, then it takes you forever and ever and ever to get what you need. So, and that's what we get, and especially for low-income folks, these programs that were supposed to fit together now are competing with each other. So I've got a guy who talks about the money that he gets. He gets money from SSI just to live on, and he pays and co-pays to Medicaid. Okay, so I mean, and we're just talking, like he says, $3 or $4. But that's a lot. That's a pretty big percentage of what he gets when he's on lots of medications. Okay? So that's a lot of money every month. You think I'm just going to pay $3 or $4 for that? That's a lot of money every month. And here's the thing. The argument is, and this is what he told me, and I went and read about it later. He's telling me, he says, you know what they told me? He says, this is going to make me feel more independent. I'll feel better about myself if I have these co-pays and I'm responsible. So you hear that a lot, actually. That's the argument. It's not much, right? Okay. And then we've got a mom who's talking about all the different kinds of insurance. She's got children who have multiple disabilities, and Medicaid actually doesn't do it. So then she's got my child on top of that. Well, that doesn't do it either. So she has another categorically disabled child, and they get Children's Special Health Care Insurance Program. So I can go talk to her, and she can tell me all the details of all these different programs better than I could, better than I can tell you anything about it or any of my students have to get out of my class. We have resources on how to access it. There's certain diagnoses that your children may have, and there's only a certain amount. You can contact them to find out if your children will be eligible. This is an insurance that would supplement your Medicare or my child program to cover expenses that may not be covered under a Medicaid program. How do we improve access? So the primary issue is in terms of Medicaid, expanding Medicaid to cover the rest of families living in poverty. No-brainer. Limiting out-of-pocket spending. Who else has said this? That draws down other resources. That's the huge thing. You don't take out of this pot to put in this pot when none of them are sufficient. Simplifying, reducing the number of programs needed to cover a person. Just for healthcare insurance, she's got to know 3 different programs, go to 3 different agencies, talk to 3 different people. Redefining family to include folks living in poverty, but those who don't have dependent kids. We're leaving a lot of people out just because they don't have children. My husband and I lose our jobs, we're stuck. With reform, Medicaid spending will still rise. This is acknowledged, actually, because everybody's going to get high quality care, but it's worth supporting. More online resources. This is where I draw all my stuff from. Federal agencies, Centers for Medicare and Medicaid, go online. You can see all kinds of details about it. Brookings, Urban Institution, Research Think Tanks, Kaiser Families USA, really good advocacy groups with a lot of good research and information. And then you've got Heritage Foundation, Cato Institute, Manhattan Institute, all those different perspectives, and you can judge for yourselves.